years with our Nemours grant. Unfortunately, that was not funded again through the CDC, but we continue to support early childhood wellness as much as we can throughout our projects within Child Care Aware Kansas. So I will let Natalie introduce herself.
Hi, my name is Natalie Updike. I think most of you know me. I work for the Kansas City Healthy Lifestyles Collaborative team, and one of the sectors I support is this early childhood sector. So if you ever have events to share, I can put them in the newsletter, so send them my way. I will send it to Shelley.
Good morning. I think I know all or most of you. I'm Shelley Summer. I manage the Kansas City Healthy Lifestyles Collaborative at Children's Mercy. And like Natalie said, I also support a number of the sectors for the Kansas City Physical Activity Plan, which is one of 3 initiatives that we're moving forward with the Healthy Lifestyles Collaborative. So great to see you all this morning. And I'm going to send it over to Chelsea.
Hi, everyone. My name is Chelsea Blakemore. I work for Platte County Health Department, and I work as a child care health consultant for the Platte County child care groups. And I will pass it to Lori.
Good morning, everyone. I'm Lori Lanter. I'm with the Wyandotte County Health Department and Child Care Licensing, and I serve with Rhonda as co-chair on this work group. I'm going to send it to Divine Scott. And it looks like Divine is in the chat, everybody. What agency are you with, Divine? I don't know that everybody knows. We try to meet everybody on their level here. So whatever you need to do here. Okay. And maybe she'll share that, but let's go ahead and toss it to Teresa. You want to introduce yourself?
Good morning. I'm Teresa Tunstall. I'm a nurse and a health educator at Clay County Public Health Center. Hi, Chelsea. And I'm also off on knee surgery leave, only they did a whole lot more because I'm an old lady, Joan. So I'm rehabbing at home. And I work on our maternal child health contract, and our focus area is physical activity and healthy nutrition.
Perfect. Well, I'm going to save our guest speaker to introduce herself before I turn over to her. But thank you, everybody, for being here today. And I am going to do a quick warm welcome to Jennifer Travis, who's the director of the Start Young program at the Family Conservancy. It's so great to see her, and I'm going to turn it over to her. Thanks for being here, Jennifer.
Oh, you're welcome. Let's not use that picture anymore.
It's a great picture, Jennifer. It's a great picture.
I thought so too.
Although, Lori, I have a new picture on the Piper Education Foundation board that might be a little bit better. But anyway,
I'll go look for it.
Hi, everybody. I am Jennifer Travis, and I do work here at the Family Conservancy. I'm actually just over a year here with the Family Conservancy, and spent about 15 years at United Way locally prior to that. And so my whole career now, which is almost 30 years in early childhood, has been spent in the Kansas City area, and then about half of it now focused solely on Wyandotte County. So my background is I do have a degree in early childhood education, and then my master's is in public administration. And so I might be one of those few people out there that actually is using both of her degrees. And so I am thankful for my school loans that I did get. And anyway, so what do we do here at Start Young? So we focus solely on work in Wyandotte County, and we are working towards increasing childcare access. And it is a public-private partnership. So the majority of our funding is coming from the Kansas Children's Cabinet and Trust Fund. And then we have additional partners in several foundations, and currently also have some ARPA funding that is allowing us to do some of our work. And I will say that we are while the unified government was taking a really long time to get their stuff going with ARPA, right now I'm extremely grateful that they did take so long. And I'll explain a little bit more why in a minute. And so how are we increasing childcare access in Wyandotte County? Well, we focus on supporting sites. So we have 14 different centers. It was 15. Unfortunately, we helped one start last year and it also closed. As you can imagine, staffing is just our number one issue, and this particular site got started, but just could not remain staffed. And without staff, then they didn't have children, and without children, they couldn't pay the bills. But so part of what we have done over the past 5 years, because we're actually just started our 6th year, is that we have helped more than, I think, about 500 slots. We've increased Wyandotte County childcare access by about 500 slots, in either helping a center open, helping classrooms open, and or we've helped a few family childcare providers open as well. And so that's one of our biggest things that we have done. And then to retain those staff, right? We've worked actually with Chris over at Childcare Aware and her colleagues to provide a wage supplement. So all of the staff at our partner centers and home providers that have a CDA or above are eligible to receive a wage supplement. And so they receive that 2 times a year, as long as they have been employed 6 months. And so that has been great. We actually have been sticking around 87% retention for the staff that are receiving that bonus. I don't know our retention rate of those that are not, but I would say it's not awesome. That's where we're having our sticking point, right? So we lose staff at these centers and then we can't rehire. And then additionally, our kind of the hallmark of Start Young is that we were able to provide gap funding for families at our providers. So as many of you may know, I don't know how it is in Missouri, but in Kansas, sometimes it can take more than 90 days for a family to be approved for childcare subsidy. So what Start Young is able to do is, if that family is eligible by everything that we know, we will provide gap funding so that their child can start childcare as soon as they apply, because we know those families need to get to work, right? So our workforce depends on the availability of childcare and childcare access, and they need to be able to pay for it. So we're able to provide that, but we also are able, there are some families that are just on that cusp of just making maybe just a little too much money, and we're able to help them with some funding so that their child can attend childcare as well. And then so for some of our families that are in Head Start or Head Start partnerships, we're able to help with some wraparound funding too, because sometimes they need care outside of those Head Start hours. So that's kind of one of our biggest pieces. And that's why when I say that I'm really excited that our ARPA funds didn't come until later, it's because the amount of funding that we have put into this community for gap funding has more than tripled. So currently we have about $400,000 going into Wyandotte County for gap funding for families to attend childcare, just at 14 of our, childcare centers and home providers. So can you imagine? That's just a fraction of what is available in our community. If we were able to help even more outside of our partners, that would increase greatly. And so we wouldn't be able to do that without those ARPA funds. And I'm not quite sure what we're going to do come next December, but we're tackling that every day. one of the other things that we do is provide support as far as quality improvement. So we provide to any of our programs that are not Head Start or Early Head Start, they're able to receive receive instructional coaching, really. So we meet the teachers where they're at, identify what their strengths are, and then provide coaching to build them up. And we also provide early childhood social emotional support through kind of two services. One is just early childhood social emotional learning specialists. They focus on using the second step curriculum. And then we have early childhood mental health consultants who work the gamut of infant, toddler through preschool. And that can be for the full class, and or they can also provide one-on-one support to any kiddo that might need that just a little bit more intense consultation. So one of the things that then all of our partners, they have to do are what we call common measures in Kansas. And so it's just a kind of menu of child assessments that we're required to do. And so for every child, we screen them using ASQ and then ASQSE. So we expect that happens at the beginning of the year or as a child comes on, and then as needed, as appropriate, right? Then we use the individual growth and development indicator to measure language development of our kiddos that are 0 to 3. And then MyIGD, which is the My Individual Growth and Development Indicator, which is actually for preschoolers. If you ever see it, it's written little MY. So many people always think that that's the infant and toddler one, but it's really preschool. We're measuring both literacy development and numeracy. And one of the great things, I mean, we have been seeing some really great growth in our numeracy skills. And we know that numeracy is actually a greater predictor to school success than literacy, which is not what anybody tells us anymore, right? We've all been focused on literacy for about 20 years, and we really need to kick up our numeracy skills. So, yeah, so that's kind of our holistic approach. And I know that there's still that we could be doing more, and probably the work that you do in focusing on health, but we really believe focus, if we're providing some of the supports that we are for families and for those teachers, that hopefully then, the center is also doing a little bit more with the health. And we do also encourage any of them to do the family childcare food program as well. Shelley, numeracy is just focused on number skills. So number naming, oral counting, patterns, like being able to look at basically a pair of dice and say which one has more. That pattern skill thing, like being able to just identify, a greater number of something, anything, is actually it's just an amazing skill. Previously, like in the 0 to 3, we used to do the problem solving in IGD, individual growth and development indicator, which is kind of like that first even step to kind of numeracy. It's just that ability to start that problem solving, and then it kind of builds into those numeracy skills. And it's amazing. I think one of the things we do as early childhood educators is to focus a lot on oral counting, and as parents, right? Aunts, uncles, everybody wants to hear that kiddo. Oh, can you count to 10? But we don't necessarily spend enough time and attention on what the number 1 looks like, and how to identify it in other places. Like, we might really focus hard on calendars and stuff, but like spending time on recipes, I think that's probably something this group could really identify with, right? Doing recipes in the early childhood setting is an actual great math and numeracy opportunity. And then the last is that one-to-one correspondence, being able to actually count the number of objects. So that's kind of that difference. And then literacy is focused on letter naming and beginning letter identification. So I think that's kind of all that we do. We do, we provide, we also work with Juniper Gardens. I guess that's one of our other partners. And we provide some additional literacy training. They have 2 projects that they do. One is Lena Grow. And so Lena Grow is the opportunity for kiddos to wear like a little vest, and they put this little thing in the vest that is kind of like a pedometer, except for it measures the back and forth language. So it doesn't count, or it does not actually record the words. Like our coaches aren't listening to what the teachers are saying, but it will measure the back and forth, kind of like what's background noise versus what's conversation with the kiddos. And then they can provide coaching to the teachers, and we're seeing, some really great growth then in the amount of language happening in the classroom with our youngest children, which we know is also really important for their later success. And then we also have Literacy 3D, which is for preschool, and it's really just looking at what are some really intentional ways we can increase that language and literacy in the classroom for those 3 to 5 year old, 3 to 5 year old. Focused on kind of like phonological awareness, because it's also a really important skill that we're not spending as much time on in early childhood. That needs very specific attention. It needs very intentional work. It's probably not just something that's going to happen by just reading books, right? You have to kind of draw attention to it. Rhonda, we have been funded for 5 years. We're just now starting our 6th. It started as a 3-year pilot through the Kansas Children's Cabinet and Trust Fund. Actually, through our previous governor, Governor Brownback, put funds in specifically for Wyandotte County. And then when it first started, the community was told, hey, you have $1 million to spend and to focus on early childhood education in Wyandotte County, if you can get $1 million match. And we had about 6 weeks to both develop a project and come up with $1 million. And the Family Conservancy was successful in doing that. And then we've been able to keep, I believe, all of our local funders as partners. I don't know that we still get a full $1 million from anybody to match that. But so it's grown from, it is amazing. I think this year, though, we have 1.8, almost 8, 1.789 from the Children's Cabinet, and then all of our additional funding from local funders. And the great thing about having that local funding is that we're able to do things that we can't do with the cabinet's money. So with those local monies, we've been able to help programs with their facility renovation. We couldn't do that with, our major funding. We had to do it with outside funding because, state never lets us do fun things like actually building the facilities, because I don't know about your communities, but Wyandotte County is lacking in appropriate facilities for childcare programs. For goodness sake, we've got to have some sprinklers, and that's a really expensive thing to put in an old building. So, and as far as I know, we're doing good this year. I anticipate we'll be able to move into next year too. But, Wyandotte County is hits. I know you guys have already talked about this probably 1 million times, but we are at the bottom as far as our health rankings in the county. And we know that early childhood education, right, is going to have a huge impact on these children's current health and future. So we know if we can help these families with anything right now that they're struggling with that supports their young children, we know that's going to have that lasting effect. And so we want to make that kind of change. I do have one other thing that I'm working on that you all can look into if you want, but Rhonda did not ask me to talk about this. So, and it's called Raising Waco. And it's really kind of our advocacy arm of childcare access in Wyandotte County currently. So we kind of consider Start Young as being that direct service portion of the early childhood system in Wyandotte County. And then Raising Waco is kind of the advocacy piece. We've been working on some policy work. We've been working just on getting the message out about childcare access. Our most recent thing that we've worked on is around the Kansas Child Care Tax Credit for businesses. We're like days away from being able to put something out there that is a kind of a calculator for businesses that they could put in there to say, I'm going to invest this much, to identify what their credit would be, and actually just some information on how easy it is to use, because nobody's using it across Kansas. And we know that if businesses started investing in it like we need them to, they would have better employees, right? And they'll be able to retain their employees. So I'll just type here. It's just super easy. It's raisingwyco.org. If you are working at all in Wyandotte County, we also have a community childcare access data dashboard on that website that provides great information about how Wyandotte County is kind of like childcare desert, and just kind of what the needs are here in our community. It's a great kind of little one-stop place to find some of that, and it will tell you where the data came from. So in case you need it, it's there, an easy place to find it.
Jennifer,
Yeah.
I was just wondering, how would I refer, I work for the WIC program.
Yeah.
How would I refer some of my moms that live in Wyandotte County to the Starting Young?
Yeah. You know, we do, this is where being kind of one of the newest staff members doesn't come in handy. But we do have a referral form, and it's on the Family Conservancy's webpage, I think. But Sandra, if you drop your email address, I will send that to you. One of the things I forgot to mention is we have these wonderful people on our staff called resource navigators. And they're the ones that when a parent comes to us through either the Family Conservancy's website or the, Start Young email address, they're the ones who are contacting these moms and other caregivers. It's not always mom, and helping them identify like if one of our partner sites is a good fit for them for childcare, and then helping them apply for subsidy and then also apply or receive any of our gap funding. So that's their full job, is to support the families at our partner centers, and then anybody who might be looking for care at one of our partners. And so I can send you that. Yeah. Rhonda, that's a great question. Gap funding goes directly to the provider. So it's a kind of a contract with the family that we enter into, and then we work with the provider to understand, what the need is, and then we send it to them. That way it's not a burden, an additional thing that the family has to worry about, like getting the money and then paying the money. It just goes directly to the provider. And it's a lot easier for us to, have 14 providers to pay rather than 200 families. So we're right now about 180 families that we're serving with our gap funding. And we're working on trying to identify any pieces that might be replicable to other communities. We're actually just wrote a grant with Child Care Aware of Kansas to kind of look at our gap funding and how we can maybe make a toolkit or something of that to help other communities design similar funding sources for families. But we couldn't do it without our major funder or any of our funders, right? I talked way more than I told Rhonda I would, so.
Oh, you did great. Very, very informative. Does anybody have any questions for Jennifer?
And Sandra, I have a really busy day. And if I forget to email you or ask one of my staff members to email you that information, you feel free to just shoot me an email, because I could see me not sending you what you want and I need you to have it.
Is your email in the chat?
It is now.
Excellent.
So anyway, thanks for having me.
Yeah,
And
thank you, Jennifer.
yeah, I know that this was, it is Wyandotte County focused. So I hope everybody found at least something maybe interesting or some way that it applies to this group. I don't know.
Absolutely, yes. Yes, we really did. I think that the work that you guys are doing is extraordinary, and the funding continues to roll in. And I think that says a lot to the work that's being done in Wyandotte. And I think that the kind of the avenue you guys are going down to look at how it can be replicated, I think is pretty exciting, because you're really system driven as well. And knowing that there's so many facets that go into high quality early care and education. So kudos to you guys.
Thank you. Some days I feel like we're just barely scratching the surface of the quality piece. I mean, just like all of you, I'm sure we need millions more to really do the things that I would like to do. But ultimately, they would all be put back into salary so we can hire and maintain quality staff, right? Because I met last week, I was one of the very few fortunate that got to meet with Senator Roger Marshall. And as we went around the room, people were sharing kind of like their background stories. And I was like, oh, wow, I just realized something. When I graduated from K-State in 1996, my first job offer with my bachelor's degree in early childhood education was to make full-time $7.75 an hour. And so I called my professor and I cried and I was like, are you kidding me? At what point didn't you think that this was important to tell us, like that you're going to make minimum wage with a bachelor's degree? Almost 30 years ago. Hey, look, it's still the same. And so now the average wage in Wyandotte County for early childhood is $10.35, I think we said. And I was like, so in almost 30 years, it's gone up a whole $3, y'all. Like, that's insane. And I don't know that he really heard me or cared, but I tried to make the point, like, that's just crazy. People can't live on that, nor can they provide the best care for our children in their most vulnerable years. When our brain is developing the most, you would think that, right? You would think a doctor would understand like the brain development portion, like this is not just caring for a kiddo because mom needs to work or wants to work or doesn't want to take care of the kid. Like, this is, our children their little brains are developing the most they ever will, and we need the right people surrounding our children. But you know, whatever. You know that. Okay. Yeah, you can make more money at Costco and benefits. Like, that's what the other point I tried to make is like, not only are we only paying them $10.35, maybe, but they're not getting any benefits. So now they have to pay for healthcare on top of that. Guess what? They don't have healthcare. So anyway, soapbox. I'm sure all of you have it too.
Any last questions?
Well, thanks for having me.
Yes, thank you for coming and just filling us in on all the work that you guys are doing with the Start Young program.
You bet. Anytime. All right. Got to go to my next one. See
Okay.
ya.
Hey, Jennifer, last
Good.
question.
Oh,
She's
yeah.
gone. I'll
Oh,
leave
I'm here.
her. She's okay. She hears from me all the time anyway.
Sorry, Lori.
Oh, Lori, I'm still here if you need me. Sorry. Okay. All right. You know how to find me. Oh, you're on mute. Lori, you're on mute.
Dude, let's try that one. You have the 14 currently. Are you looking for any more? Are we sending your way? Are you content?
Well, I have one more that we helped open who moved from a home provider to a center, but we're not claiming her yet because she hasn't been able to become a DCF provider. And I don't know how to tackle that, honestly, because it's a big, long history issue. It's a personal history issue, which is unfortunate. So yes, we could take one more center with our current funding levels, but we're right now really trying to bring on home providers. We have a brand new, so much that I left out, kids. So we have a family child care coordinator who is actually focused solely on either recruiting home provider or, individuals who want to start their business. We have funds to help start them up. And then they could become a full partner as long as they become a DCF provider, and get all the things I talked about that we do for centers. All of that's eligible to them. But we're also trying to identify any in Wyandotte County right now that might just be on that cusp of closing. Because I believe that in retaining them, we're also increasing access, right? Because if they close, then we've lost that and we may not have anybody else to fill their shoes. So if you got any of those, or as you're doing your orientations, yeah, we would definitely like to have more home providers, because that's where it is in Wyandotte County. We have many more home providers than we have centers. And we have this brand new person who was a home provider for 25 years, who can, support them in a way that we haven't been able to do for the past 5 years. Because I know center and I know early childhood, but I don't really know the ins and outs of home providing. And so I'm super excited. And she's already rocked it. And we have one more that's coming on board. We had another one again that started and closed. But she got a job offer in a preschool in a school district. I can't fault her for going and taking that. Like, you go get that steady income. So, yeah, that's
Thank
it.
you. Mhm.
Yep. All right. Thanks, guys.
Thank you.
Bye.
Great, excellent, excellent. Well, we'll continue our agenda for today. I will tell the group that Lori and I are going to share the agenda, because I do have to jump off in about, I don't know, 15 minutes. But we wanted to continue our early childhood sector meeting agenda. One of the updates that we wanted to share was around the Bach materials rebranded to Active Kids. Natalie, did you want to bring that up to share? I think she put it in the chat.
Yeah. I had put it in the past newsletter, but they just emailed me the day after I sent the newsletter that they were rebranding and had a new website. So that was unfortunate timing. So the materials I sent will still be on this other website, but when they make new materials, it'll all have this Active Kids branding. And it is a free program that you can sign up, and then it's got nutrition and physical activity activities and curriculum to use in those environments. I don't know if any of you had a chance to look at some of them.
I was curious what they had for children under the age of 3.
They had an early child care curriculum resource that I put in the newsletter, and it looked like it had just a whole bunch of different physical activity options. Of course, now my password, maybe since they rebranded, I have to make a new password. I might just try to put it in next month's newsletter and see if I have time to work on it then.
So I wanted to tell you guys, I am, I'm a Go Knapsack consultant through Missouri. And we had a meeting last week, and I was on it, and Richard, I think it's Raleigh or something. He's from somewhere in South Carolina, North Carolina, something like that. But anyway, he is going to be presenting a thing on Active Kids. I think it's next week. It's like it's a webinar for like from 12 to 1 on Wednesday, August 30th. So I was going to try to join to that and listen and learn more about that. Yes, Richard Raleigh, that's right. So anyway, I was going to listen to that one and see if there was anything that I could share if you guys wanted to, or yeah, so just let me know.
Yeah, if you wanted to report back at our next meeting, that would be great. Excellent. Well, Natalie, I'm gonna, do you want me to flip it over to you to show the survey?
Second.
Yeah, no worries. So we're going to move into the part of the agenda now that we're going to talk a little bit about the work that the implementation groups have been doing. You remember we have one that is focusing on appropriate resources around physical activity, and the other one is around looking at our data. So that small but mighty group has been working on a survey, and we have it drafted and ready to be able to share with some feedback. So in hopes that we will get it out, we have our timeline set up that it will go out in September. So we wanted to share that with the group today.
Based on our last meeting, you wanted me to like come up with like an email template for you to send out. So I just put kind of the intro to the survey itself and added how much time it would take, like you suggested. Maybe let's put it easier to see. And then put a QR code and a link based on whatever option they have.
Excellent.
And then if they want to check out the KCPA plan. So I can share that with whoever is going to actually do the distributing.
Excellent. That looks great. And just to remind everybody, the purpose of the survey is kind of multi-leveled. In a sense, it is to send out to the providers across the 6-county area that the KCPA plan covers. And it is to ask providers if they currently use resources that we've compiled. The next question I think that we ask is around, how often do they use it and what purpose do they use it for? And so Natalie's kind of walking through that right now. Natalie, can you make your screen a little bit bigger? Great.
I can start at the top again.
Perfect.
I added that question about what type of care setting based on our last meeting too. I think that was the only addition though.
So we wanted to first kind of know, what resources are they familiar with through experience that they have with working with perhaps a coach or any quality improvement plans or designated curriculum that is utilized at their facility. We came up with this list. Then we wanted to know out of that list, how many do you use as a provider? And then the next question addresses resources that they have shared with families. And then we had an open section that they could list any additional physical activity resources that they use. And then we asked some pertinent questions around, is there a need for more provider resources to promote physical activity based on the list, as well as the list that they provided. We asked their opinion about if they would like these resources to be on a single website. And then we also asked, in addition to online resources, how else do they access resources? Is it maybe from their licensing agency? Is it from county organizations, the health department? And then we, of course, want to recruit anybody to come to our early childhood sector meeting. And so that's something that we ask at the end as well. In the first 50, am I right? 50 respondents will get a copy of the Dr. Kraft Get Active book. So I think if I might have my notes in front of me here actually. I think that when we last met, we talked about the potential reach and the potential reach. Oh, let me see if I have my notes here. Gosh, was over 1,000. I know that providers across the 6 counties. So, we're hoping for, I think, 5%. That would be great. Maybe if we get more, that would be even wonderful. But one of the things that we're looking at now is what one of our partners would be most appropriate to send out that introduction message along with the survey link in hopes that we can get some good return rates And so that is something that we are working on next. We've got an outline of it for sure. Does anybody have any questions or about the survey? Yeah,
I have
Jamisha.
some questions. So of course, I'm the executive director at Start at Zero. And so we do early childhood home visits for those of you all that haven't met yet. So these surveys and just kind of the landscape, it's really about childcare providers. But if we're focused on the ecosystem, then we have to focus on home visiting and those parents that keep their children at home that aren't in any home visiting setting or any childcare setting, because they're the ones that are frequenting, gosh, I have to say that this morning, websites to find materials for their kids as well. PBS Kids, I was always on their website when my kids were home full-time with me. And so these other resources that are local that I would have been able to pop up to, then that would have been helpful for me as a parent and helpful for parents that aren't engaged in any kind of system. So I wondered if there could be some additional questions or a different type of survey that also included more parts of our ecosystem, so that we can rebuild everything, not just the providers, because usually we're kind of handing families off like, you feel like you're in a good spot, we can answer your questions and help you transition to a center. But usually, especially with our families, they prefer not to even do that until the kid is around 3. So then there's this smooth transitions and handoffs, but the home visiting space isn't getting the same information and opportunities to engage with the different things that are available.
Sure. Thank you, Jamisha, for sharing that. Shelley, did you want to?
Yeah, I think to give you a little background, Jamisha, the reason we're looking at early care and education providers is because with the team that we have on the resource implementation group, that's who they have access to. I think home visitors, excellent. How do we get more home visitors engaged in considering completing the survey? If you can help us with that, absolutely. We think that's I personally think that's an excellent idea. I don't want to speak for the rest of the group because I'm the one with the least amount of early childhood developmental experience. So, but I do think that's a great idea. In terms of your comments about parents, I recognize that and think that's probably another great group to get feedback from. However, this survey isn't designed for parents. Where you and your program would be really helpful, as well as other home visiting programs, is helping us figure out, once we identify, and I'm sort of making up a number here, but let's just say the 20 best resources that providers and home visitors can agree on. Then what's the next step? How do we get that to the end user? So not just care providers, whether that's family-based or center-based, but also parents who are staying home with their children. We don't really know the best way to get to them because we've been trying to do this for over 10 years and it still seems we're not hitting that population. And so I'm not sure this survey, so based on what you just saw, this is a list of a bunch of resources that have been identified. I'm not sure parents would even be familiar with most of those, but you're 100% right. We want to get it to them. In fact, at this point, we are trying to get a few key people to complete the survey before we send it out broadly, just to make sure it makes sense to the people who are doing it. So if you'd be willing to do that, that would be fantastic. We'd love your feedback. And for anyone who completes it in this sort of pilot phase, we're still providing the same resource or incentive that's available to anyone else who completes the survey for us.
I think with surveys, I used to do a lot of survey creation. They give you information that you're not, like, if everybody answers that they haven't heard of any of those resources, then that's information too. So I looked at it like, oh, we haven't used any of these. I haven't even heard of half of them or 75% of them. So that's also information as to why home visitors aren't even using it, because we haven't even heard of it. So now you'll take that and go Google the different resources that are available and then begin using them. So I think surveys are always a great idea and they give you some information. So kudos to you all for even putting that together to get input and feedback for sure. And I just jumped in really quick because I do have to go and I hate to do that, but I always love being here in good company with early childhood advocates and providers and supporters. So Yeah.
Well, we'll send you that survey link, Jamisha, and
Yeah.
if you would complete it for us, that's fantastic. And then
Give
just
you
let
some
us know.
feedback too.
Absolutely.
Okay.
Appreciate
I'll
it.
do that. Thank you all. I'll see you next time.
Thank you. Any other
Um,
questions or any other suggestions or feedback?
I was just gonna say, I'm happy to spread the word for y'all at OB. 'Cause I feel like after being there for almost, this will be my 5th year going on in January, I finally feel like I'm being able to be heard, and they kind of know what I'm doing. So it's taken a long time. But I do think that is something that I would be happy to, if you guys send me the link, even just if there's a trial or pilot, whatever, that's fine. Just let me know.
Okay, yeah, I guess I'd like your guys' help, maybe identifying like 5 more people to pilot it, like specific PC partners. I'm hoping to get that done relatively quickly in the next 2 weeks, and then I can put the survey into production, and then it'll be ready for that September 18th date to go out to everyone.
Is there anyone else from the Family Conservancy that you think would be good to sort of do the first few practice surveys? I don't know if it makes sense for Jennifer because she's I don't know if that would be part of their program.
I think possibly Jenny Brandt, because she's already very involved in a group that we do send surveys to check in with. Chelsea's like, yes, okay. With providers on what their needs are. So they're kind of used to hearing from her, and she has a good rapport with that.
Would you be willing to send it to her, Lori? Only because if we just send it, she may ignore it since she's not really looking for an email from us. And it, you have to set your priorities somehow.
Don't we already have Katrina on that listing to send it out?
What do you mean? To send it out, to disseminate it broadly or to pilot it?
To disseminate it. I mean,
Yeah.
Jenny
We
and
want a
Katrina
few
are
people
probably
to
gonna
pilot
have the
it. but
same group of folks. Are you just thinking about where to identify it coming from?
No, we want to pilot it.
Oh, I'm sorry. Okay. Then I would also make sure is it Amy Cochran and Mary Williams and Emma from Family Conservancy.
Okay.
I mean, how
So
many
the
you
ones
want
on the
for Family
resource group?
Conservancy to complete it?
Say that again. You don't know there's that many that could complete it?
Well, they all work with different, Jenny is further removed from working directly with providers, but like Amy and Mary and Emma work more directly than Jenny would,
So would be more familiar with the resources.
probably.
And I'm happy to send it to the 3 of them if that's what this group decides to do. But I also, so what we want them to, I just want to be clear on what we're asking them to do with piloting this is, are you wanting those actual individuals to fill out the survey, or for them to identify a provider that they work with to them actually filling it out?
For the pilot,
Mhm.
we want the person we ask to complete the survey and give us any feedback about what's not right. What doesn't work? Maybe
About the
that's a bad
survey
question.
itself,
About the
not-
survey itself.
Yeah.
Correct. And this is the reason for this, just to give you some background, is for the type of survey tool that we're using, in order to disseminate it and gather the data most effectively, we have to put it into production. When you put it into production, you can't make any changes. So if somebody came back and said, well, this is worded really funny and I didn't understand what you were saying, we can't go back and change it at that point. We got to create a whole new survey. So before we put it into production, we want to get 5 or 6 people who we'd be asking to complete the survey anyway, to do it, give us feedback so we can make any adjustments and then disseminate it broadly. Does that make sense? I see head nods.
Does make
Okay, good.
sense.
Okay.
Are we also planning on sending it to those, I know we had originally said, the people who had kind of done our pilot, when we were doing the outreach to the providers in each of the counties? That last thing we tried.
Do you mean with Emily Meisen Sebelius? Or something more recent?
More recent. What was Emily? I'm trying to think of how long ago that was when we reached out. I think it was right as Emily was leaving when we reached out and we had the providers and we were doing a cohort for that.
I don't have the names. I still can't
Okay.
find the names of all the
still-
people
okay.
who participated in that. No, it had to be in her files that have become very difficult to try to access.
I get it.
Yeah. Versus on our shared folder. So that's
Okay.
that was our error, but
Okay. And then I would like to schedule a resources group meeting prior to those surveys going out on the 18th. So if anyone could throw out some days before the 18th of September that work for them. At that meeting, I want to, I think, discuss some of those people like Katrina or Amy or like make sure they're all on the same page, have things that they need, and then talk about how they're going to disseminate it.
I don't know anybody else, but Fridays are actually pretty open for me. I know a lot of people don't like Fridays because people start weekends early, but my other days fill up and those tend to stay pretty clear.
Fridays work better for me too in the morning.
Maybe like the 8th.
September 8th looks good for me.
Okay.
I
Do you
could do
wanna-
like a 10:30 on the.
Okay.
I can't do that. But that's okay. You guys can meet without me. I could do 9 to 10. Or earlier if I need to.
Okay. Might need your guys' help remembering who to include on that invite too. That's going to help with that process of distributing the surveys.
Natalie, I can send you Emma and Amy, and I think we determined Katrina's name and Mary Williams. I can send you those email addresses.
Emma, Mary, Katrina. Okay. Were we going to include, was it Kyle from Mark?
Oh, Kyle, Matt. He does. I mean, if we're talking about people that providers are going to recognize an email coming from,
Yeah.
I'm not sure that would be Kyle.
Okay.
But others may have other thoughts. I mean, he's, works at Mark, more of a support.
Okay. But the people you're mentioning, Chris, that would encompass the counties in Missouri and Kansas?
for Emma and Mary, Emma and Amy, I believe that theirs is by state, that Family Child Care Network. Katrina works by state. But I'm not sure how far their reach is. I mean, we can talk with them about it, or you can put in the email if they have colleagues on the, Missouri side to include them.
Okay.
I mean, I know eventually we've had, like on the Child Care Work Kansas team, and we've had Chrissy and Maddie join some of our the sector calls. They're the Child Care Health Consultant Network. So I mean, if you're going to get down to, even deeper level, but I think the broader the reach, the better. And sometimes providers need to get, not just providers, people need to get things, multiple times before it actually resonates. So repeat is not a bad thing.
I think maybe at our last meeting, we mentioned doing the like large blast from one person, and then after like 2 weeks, if we don't see a lot of people participating, then we were going to involve people like Chrissy and Maddie to individually ask and push again. And then I wrote that we would wrap the survey up by October 8th, hopefully, from our last meeting. I also talked to Dr. Kraft on the phone yesterday, and she's going to help us with shipping the books. And she also mentioned that she's open to doing in-person workshops if we are ever interested in her coming to Kansas City. Okay, I'm gonna, I think, schedule that calendar invite for 10:30 on that Friday. The last thing on the agenda, I think, is talking about our sector meeting in September. It overlaps with the Kansas City quarterly meeting, or Healthy Lifestyles Collaborative quarterly meeting. So I want to talk to you guys if you wanted to just skip the sector meeting for October, especially since we're already going to be meeting in the middle of the month, maybe with this resource group, or we
Skip
can
for
pick
September
September, sorry.
and move to October.
Does anyone have any strong opinions?
No strong opinions, especially like you said, we're going to meet early for this other work group stuff, and potentially even again after that, since that those deadlines are going to be fast approaching with the so I would think it would be okay if we skip the big one and do those working groups, smaller working groups if we need to.
Okay, that sounds good. And I think that's all we have today, unless anyone has any like organizational events or updates to share.
Well, Natalie, we did have on the agenda the Go Knapsack report review. Was there, Shelley, were you going to do anything on that, or is that somebody else that was planning on updating?
I think the biggest thing with that really is that group was taking the summer off. There were a couple of things that we were waiting to get into place before having another meeting. There were, and I can't remember, but it was Lori Lauer and Kyle Matchell who had a couple of things that we were waiting to hear more about before following up and scheduling another meeting for that implementation group. So what we're trying to figure out is the time to set that next meeting. Or does the group think, let's move forward with the resource survey first and spend our efforts really focusing on that, and then come back together maybe in October, November, with some hopefully results that might better help us as we identify the gaps in the Go Knapsack information and what's going on in the state of Missouri to figure out our next steps. So no real updates on information for that group, just really how do you all want to proceed? What do you think is the best? Well, here's one consideration. So is Richard the one that we're talking about with active kids? I feel like he's the same Richard from Go Knapsack.
He
Yeah.
is, yeah, that's
And
it.
so one of the things I wonder is having him come back and present maybe at the October meeting, just like Jenny or Jennifer did today, having him give us an update on what they have moving forward from that standpoint, because the truth is that is probably one of the resources that's not included in the survey that nobody's going to know about, because first, it's not, it may not be new, but it certainly is new or rebranding. Have him do that and then follow up afterwards with the meeting, sort of with results from the survey and what do we do now with that information we have locally.
I think it's a really good idea because that was the other thing that he talked about. And I do believe they did talk about the survey results. I don't remember that much details about it. I wish I did, but I think that's a great idea, just to go to the source, because I know there was another gal that was on there that had done more of the survey kind of thing, and she shared it, but I think that he could definitely share it on her behalf, I'm sure. So yeah. And I also want to just tell you that my group of students and I are presenting at the Kansas Occupational Therapy Association conference on September 15th in Lawrence. So we're presenting on our research that we did with Operation Breakthrough staff we used the PALS program and Go Knapsacks for physical activity. And we did a pre-post study, and we demonstrated that they all grew in their knowledge of physical activity best practices. So that was kind of cool. So we're going to share about that.
Yay.
Teresa, did you still have something?
I just wanted to remind everybody, our big event that is associated with our maternal child health monies is Family Fun Day. This is our 7th annual one. We survived through COVID doing it virtually, and this will be our 2nd time to hold it at Mackin Park in North Kansas City, which is, I would judge, I've been a Northlander for almost 50 years. I think that's one of our premier parks in the Northland. And we're up to 42 vendors, and we're still having vendors pursue us, and food trucks, and we've got high school bands involved. It's centering on physical activity and healthy nutrition. And it's going to be Saturday, September 16th from 10 to 2. So I invite you all to come for a little bit. It's a great event.
That's exciting. Yay, congratulations.
Thank you.
With that segue, does anybody else have any other events coming up that they would like to share? And as always, if something comes up in the meantime that you want to get out to the group, then send that to Natalie and she will get that disseminated to everyone. More work, Natalie.
Okay. Okay, I think I'm going to stop the recording.
All right, with that, I think we have our, we'll go back